Thank you very much for that introduction. So I have 3 cases. My first case, this patient presented with PIH actually from prior laser hair removal on the face. If you look closely at her cheek, she has some kind of circular areas of hyperpigmentation that were bothering the patient. And she wanted to do a chemical peel to improve pigmentation. She was a little scarred, no pun intended, from lasers, and she wanted something kind of more gentle to help improve the pigmentation. So this was during fellowship, just so all of you know, but we applied Vaseline to her alar grooves, canthal creases, and mouth corners, and then we performed a medium depth chemical peel, a light medium depth chemical peel that specifically is marketed for patients with darker Fitzpatrick skin types. I don't think this is a CME. We did the precision VI peel. Which is specifically for pigment, and they say it's good for darker skin. We got subtle uniform frosting, and then she presented about a week or 2 later with new PIH, now in the alar groove, as well as the mouth corner from this peel. So just a few learning points from this case. The patient did have some improvement of the PIH on her cheeks, but then she developed new PIH in other areas of the face. After she was fully healed from the peel, we treated the patient with low-density 1927 thulium laser. We did the Fraxel 1927, 1014, and got to a total kilojoule around 0.8. So very light settings. And she did have complete and full resolution of PIH. One caveat I will say is I find this PIH from peels tends to be a little bit more responsive to light laser treatments than true PIH from other lasers. But just a few learning points from this case. I think lasers are a little bit more, you can be a little more precise with them if you know what you're doing. And you do have to be careful with peels and skin of color, even if you do everything right, even if you use peels that are marketed for skin of color. And personally, I am more comfortable with lasers in skin of color.
Maybe just, again, because we had a speaker actually drop out from the session, so we've got some extra time as well. I just had a couple of questions about that case. How long was the PIH present initially from like laser hair removal?
A few months.
Okay.
Yeah.
And then do you use any topicals to prime the skin when you're doing lasers or peels to try to mitigate like PIH?
Yeah, and this patient actually was on combo hydroquinone cream for her initial PIH. It was stopped a week before the peel.
And do you think the PIH in just those areas was perhaps technique dependent or something about the anatomy? Or?
Yeah, I think it could be partially technique dependent. Again, I highlighted that we did the Vaseline in the right areas. I think sometimes it's just, yeah, it can still happen though.
And what are you two doing for PIH? Do you treat it? Do you use topicals? Do you opt for laser? Do you jump to a peel?
I mean, it's pretty amazing how fast her PIH came up afterwards. And it's interesting, like the application, you know, how it got into the grooves. But, you know, I do prime ahead of time and afterwards. So,
what do you prime with?
I prime with hydroquinone, usually 4%, plus a retinoid, usually like tretinoin 0.025, and then a steroid, usually like a fluocinamide, which is strong for the face, but in a short amount of time, it's okay.
So I actually do a lot of VI peels, since it's not seeing me, in my office. And most of my patients have melasma, and so they're already priming with hydroquinone. We have them stop it like a week before they come in for their peels. And it can be technique dependent in the matter of once you're applying, you're supposed to wait, you know, like a minute and a half, see how that skin reacts. If you see any type of whitening or any type of irritation, then you shouldn't go over those areas. But that patient might have had irritation before. Sometimes I do find that if they have acne or the hydroquinone has irritated them in certain areas, and those tend to be areas where they can get irritated, then that can definitely happen post-VI peel. But I do find that just treating with a topical steroid once you do see that they're irritated before that hyperpigmentation develops is essential, and they do respond very well to that. And if there is any remaining hyperpigmentation, then that's something that you can treat with like a lightening agent, but I'm sure a laser works just as well.
Great. And I do, I guess, a lot of, I should say, I do a lot of like lighter, like more superficial chemical peels in the skin of color, which I haven't had any issues for. I just thought it was interesting that this one is specifically marketed for skin of color.
Parameters with the 1927?
10-1-4.
Explain that.
10 is the depth.
10 millijoules.
Sorry, 10 millijoules, yeah.
Treatment level 1,
And 4 passes.
4 of 8 passes, if you set it up as a default of 8 passes, so you're delivering half that treatment level essentially. That's,
I actually do set it to 4 passes.
so you're doing a full, oh, so that is a full
That's
then?
different than
Yeah,
doing, setting it for 8 and doing.
yeah,
Yeah.
okay, all right.
So
But that's just on this one device.
On this one
Yeah.
device, yeah.
if you were using a different Dueling device, like LaserD Ultra, for example, electronic device, what parameters would you recommend?
I've never used Lasem D personally. I know like the Clear and Brilliant, I would use like maybe like a level medium.
The density of treatment level 1 is about, do you know, is it 30?
I think it's around
Yeah.
30%.
I think the treatment level 1's are 30% density.
It's pretty dense.
That's pretty good.
Can I ask you a
Yeah.
question on this case? Actually, I have 2 questions. Usually, when you get that hyperpigmentation, you see much more frosting. And they've been treated with retinoids. That's when I do precision all the time, and that's when I see it. But you had done a much better job of using Vaseline. I only use it in the corner. Are you going all the way to the triangle? Because then I feel like I'm going to miss out on treating that area.
I usually do the corner mostly, but I do kind of here. And who knows, maybe this patient was just more prone to PIH than our average patient. Maybe she was a little irritated from the combo cream she was on before.
And the peel that, it comes as Precision, Precision Plus, Precision
Yeah.
Plus plus Booster. Which one did you do?
I'm pretty sure this was the Precision Plus. Yeah.
Do you think she was like drooling in that area? Like, it's just an odd
I know.
pattern. And, because it almost looked like there was like substance, like to the PIH. It wasn't just like PIH. I don't know.
Yeah. Okay, next case. So this patient presented wanting to improve the crepey skin in the periocular area. This is a very short case. She was open to lasers or chemical peels, but she wanted to avoid surgery. So what did I do? I did a CO2 laser on her, and this was her result. I don't think, at least in my hands, I can get this sort of result even with a aggressive like TCA peel. And I would be interested to see what the panel has to say. I think just like the periocular tightening of that crepey skin that I get from the CO2 can't be replicated with a peel that easily. Full disclosure, I don't do phenol peels, so. What are your thoughts, Anthony? I know you do a lot of peels.
Well, I think this is an amazing result. So great CO2 work. I do think you could potentially get this with a phenol peel, but outside of that, maybe an aggressive TCA. It's just, I think in this area, you understand the control of the laser and you know how the tissue will react. And so, but with a phenol peel, you probably could get that too.
I know I am not an expert with peels. I know some experts, who can do something like this with a peel, but I think in terms of where the lasers, specifically the CO2 in particular, really shines is this area, and I personally feel more comfortable with that precision of the laser, I think, to try to mitigate any potential risk associated with the technique of the delivery of the peel in this area. I think you got to be very, very careful, and so I think there's definitely a very steep learning curve there. There's definitely a learning curve with the laser, but I think with the laser here you can be very, very, very precise and just shave down the layers of skin as you make your passes in this area and be very controlled about it. So I love the CO2 in this area as well.
Which CO2 laser?
The Luminous Ultra Pulse.
I do think, regardless of whether you're using a laser or a peel, that you should, test the laxity of the lower eyelid and make sure they don't have too much laxity to begin with. They have a good recoil, because if they're very loose, and they don't have like a good snap test, like pulling it down and then it recoils back up, you could be at risk of getting a tropion from either a peel or a laser. Only if you did like a more aggressive peel.
So I noticed that, was it active or deep or both?
This was active, 2
Just
passes.
active?
Yeah, I did 125 millijoules, density.
125.
Yeah, density, I believe I did density 3 or 4, and then I wipe, and then I repeat it again.
2 passes.
2 passes active.
It's amazing.
Thank you.
At that density, you'll get into with the wipe between, you'll get into the early dermis, yeah.
Yeah.
5 is almost 100%.
Yeah.
5 is almost 100%, and 4 is getting up there. And this looks pretty gnarly for 1 to 2 weeks after, but it heals beautifully.
Do you anesthetize with infiltrative lidocaine?
Yeah, I do usually a little topical 30% Lido first, and then I do kind of infiltrate under and over with 1% Lido with Epi, and it's very comfortable. You do have to put, obviously, the eye shields in for this, too.
And you go all the way to the tarsal plate? Like, are you
Yeah.
going right at the lash line?
Yeah. And I usually like feather it out on the edges and go most intensely where they need it the most. Okay, anything else? Okay. Oh yeah, in my opinion, nothing tightens skin around the eyes like CHA. Okay, my last case. This patient presented to clinic wanting improvement in her skin quality. She's a busy schedule. She lives most of the year out of state and ideally would like same-day treatment. And she also is somewhat cost conscious. So for me, this is my perfect peel patient. It's a patient who comes in, maybe a little more cost conscious, who wants same-day treatment. Feasibility of doing a laser same day gets tricky with laser availability and doing topical numbing. So for these patients, I love peels. Great same-day treatments, and they tend to be obviously slightly less expensive than lasers. So what did I do for her? I did a 30% TCA peel, full face. I did a 15% TCA peel around her eyes. We usually cleanse the skin first. Again, I apply Vaseline in the alar grooves, mouth corners, and canthal creases. We cleanse with acetone until you get almost this like white frosting almost from the acetone to make sure that all of the grease is off of the skin. We do alcohol before that. And then I typically do first 2 passes of the 15% TCA peel right up pretty much to the lash line. I do sometimes use a little Q-tip to apply a little Vaseline right on the lower lash line. And then I do 2 passes typically of the 30% TCA full face, waiting a few minutes in between to see my good uniform frosting before going back for my second pass. And here she is. I didn't do her upper eyelids. She was more just concerned about her lower eyelids. And then I think it's interesting, similar to lasers, how everyone heals differently. This patient got very puffy after this. She sent me her pictures after she cleaned her face and snipped her peeling, so you don't see much peeling here, but you can see with 30% TCA peels, people can definitely get puffy, they can get red, which is within the realm of normal. Usually I tell them by about the 1-week mark, they can kind of restart putting like makeup on and they're looking relatively normal. But this is before, and again, she lives out of town, so this is a selfie. But you can see some definite good improvement in some of her skin quality, especially on her forehead there. And I just included this one picture. This was our esthetician who I did another TCA peel to, just so you can see the degree of peeling a little bit better that I would expect from 2 passes of a 30% TCA peel. And this is just from Delasco. And I know we were talking about this. Whenever I do peels on my staff members, like all my patients want peels because patients come in and see all these people peeling, and then they want to hop on board. So it's kind of good marketing. And again, this is her just before and after, and she definitely thought there was some, improvement in her pigmentation and skin quality. Thank you.